Welcome to the Medic Side Hustles podcast. I'm your host, Dr. Shubhendu Kulshreshtha, an executive coach and an emergency physician helping clinicians like you make medicine your side hustle. A very special thanks to Dr. Akash Vijayan for producing that beautiful intro music, especially for this podcast. Now, if you've ever wondered what a career in medical affairs and pharma might look like, pay attention to this one. Because in today's episode number 14 of the Medic Side Hustles, I sit down with Dr. Abhinav Keshwani. Dr. Keshwani is a good friend and a fellow alumni of KMC Manipal. And after being part of the founding committee of the best ever surgical society, Cutting Edge, he went from MBBS straight into the big bad world of medical affairs. He's worked with big giants like Bristol Myers Squibb, Sanofi, Bioclinica, and other brands that you might have heard of. We hope today to dive into a few things, depending on where the conversation takes us. We'll hopefully talk about the skills that make clinicians valuable in their medical careers, in medical affairs rather, how to move from support role to a strategic contributor, but maybe a bit about career pivots from hospital wards to global pharma and impact, and probably a little bit about why relationships and storytelling matter in scientific roles. In the second half, I'll hand over the hosting to my guests and let them ask me whatever they want to ask me about any sort of insights or questions about non-clinical careers. Live audience, you get to have your questions answered at the end of the episode, so please do drop them in the comments below. So thank you so much for joining me today. How are you?
I'm good. Thank you so much for having me, and it's always a pleasure to connect with you. And at the context, I love what you're already doing with medic side hustle, because I can also correlate that how clinicians can move from their core clinical traditional practice to a lot of diverse areas of contributions from the medical side. And obviously, the common interest that we have, starting from medical innovation, entrepreneurship, and obviously the food
Oh, yes.
that we
How
love.
could I
So
forget about the food?
absolutely. So that's basically about how I want to. I today I would be sharing my journey
Mm-hmm.
from being a clinician to how I've moved to a corporate world of pharma medical affairs. And before I start, I want to give a disclaimer that I am not representing my organization in any capacity, and the views shared today are going to be my personal views, right?
Absolutely, like a very quick introduction into what medical affairs and pharma is actually like, full of regulations. But actually, I'm really
Yes.
glad that they don't want a piece of this because this is your journey and this is your learnings that I want to help share with the rest of the world. So it doesn't have to do with any of the companies, but it's about how you navigated this pathway and what are some of the insights that you've harbored or gained along the way that we can present to our listeners. So, yeah, it's not for any company to try and take over. It doesn't represent any of them. Lovely.
Yeah. Yeah.
Fantastic. So I think for our listeners, just give us a quick overview of what your careers looked like, and we'll then dive into some of the bits within that.
All right. So, to be very fair and honest, it was never a meticulously planned roadmap of moving from clinical to pharma. It was more about when I started my journey working at a charitable hospitals in
Mhm.
North India, treating one patient at a time and looking at the immediate impact that it created on the patient's journey
Mm.
or life. And there, working in the emergency department, I realized that when we zoom out and look at a larger picture of how our initiatives can make a real impact in patient journey, as simple as improving the quality of services at the emergency department and reducing the time from the patient enters to the first interaction with the clinical physician, right? So from there, I zoomed out and see how I can help the organization effectively utilize the resources, because you can understand the charitable hospitals looking after thousands of patients in a day and with the limited resources in hand. And there, I was also driven by the idea of starting something of my own.
Mm.
And that was the larger goal. But then when I zoomed out and reflected, I realized that I need to hone my skills in terms of the operational aspect and what it takes to scale this vision at a larger scale.
Yeah.
And what are the strategic understanding that I need to develop before I
Mm.
move there. And that is the target that I kept, and that helped me move into the pharma
Wow.
world.
So I really like that. So I think I have a very strong belief that everyone kind of comes with their own lens in the world. So not every doctor is the same. Of course, we're all very different specialties, but also the way we look at the world is very different. And it sounds like you could see the operational inefficiencies and how you wanted to sort of move the resources around to make the biggest impact and biggest difference to patients. And it sounds like you were working on realizing what skills are missing and what else needs to be done so that you can create that and make that happen. So, what was it about the world of pharma and medical affairs that made you believe that that's the way that you would get those skills and hone those skills? And I guess
Um,
kind of also layer that into what the hierarchy of medical affairs in general looks like.
that's great. So before I start on that, so once I took this decision that I am going to move into the pharma world, I actually spoke to a lot of visionaries who are now my mentors before taking this decision. And one of them clearly mentioned, then, do not believe that your clinical experience is going to be left behind and it's going to be your past. Use this as your launch pad because that is going to be the center of how you're going to succeed in the pharma world, right?
Mm,
And obviously, at the center of all this was my curiosity to learn more, to see how I can help in improving the patient care. That has been the same till date, and I'm sure that it's going to be the same in the future because at the center of whatever we're doing today is the improvement of patient care or outcomes in patients. And if I give you a background of how this journey started, so I started working as a regional medical advisor, or some places it's called medical science MSL, medical science liaison. Then moved to medical advisor, which is more of a HO role, and then the medical lead and now the therapy lead for cardiovascular therapy. And I remember when I was sitting as MSL in one of the first cross-functional meeting, we call it a life cycle meeting, right? And looking at the strategic discussion that we were having there, I could, at that time, I could correlate, then I am sure that I can contribute to this strategic discussion and decision with my clinical expertise, keeping patients at the center of what we decide
mm.
for
Tell me a
the
bit more about
organization.
that. Like, what was it that even though you were new in this organization, new in the role, you realized the value of your clinical exposure in this room full of probably non-clinicians. Tell me what was the piece that was the most valuable.
I'll give you an example of a launch,
Mm,
right? When you launch a molecule, from for the external world, it's the organization coming up with a new product. But being in the medical affairs, and just to give you a background, in a launch strategy, the core department or the function that plans the whole pre-launch is medical affairs.
right.
You're not just looking at the science behind it, you're looking at the access, regulatory, patient support program, patient access program, the awareness, education,
Mm,
and the whole idea about the strategy ops. So
okay.
this is where the medical affairs is centered around within these cross-functional teams, right?
Mm,
And by launching a product, you are not just launching a molecule, you are shaping the way the treatment is evolving
okay.
and the diagnosis. You fill in the gaps or the leaks that are currently existing in the diagnosis. So if you see that way, you're actually working as a holistic approach
Mm,
to improve the patient outcomes.
right.
And one of the examples is that when we work towards the patient centricity, the first aspect is whatever decision we make, we decide on, we need to keep patients at the center, thinking how our decisions would impact them and not the
Mm,
other way around. So it's like you don't decide and then see the impact. You keep them
in the center.
included in the discussion.
Yeah.
And then that's why now you see in medical affairs, you have a lot more patient advocacy group meetings, and these things are evolving more.
So this is very interesting. As you were kind of saying that, I was trying to draw a parallel straight into the clinical world. And by the way, we're getting a lot of engagement, people finding what you're saying very insightful and liking the content that we're talking about. And thank you. Thanks for, I'm glad you're enjoying this in terms of the audience. As you were saying this, I was trying to draw a parallel directly straight back into the clinical world so that maybe the clinicians who don't know what industry looks like can think about it. And correct me if I'm wrong, but in my mind, like launching a new molecule might be equivalent to, say, creating a new surgery, or like, the first time the total knee replacement was done, for example. And then you've got at the core of it this treatment that you want to deliver to the patient, but then you've also got all of the other things around you. You've got new physiotherapy, you've got new pre-op plans, you've got new anesthetics, you've got all of these other things that need to work in order to make this happen. And in that sense, it's very clear to see how the clinician is often at the center of it. The surgeon who will be actually doing the surgery holds the most amount of scientific information, and is kind of the center of that world. Is that kind of where medical affairs fits in, or how else would you kind of relate medical affairs in that scenario?
That's exactly the place where medical affairs is right now. But
Mm.
then I would see it evolving more, because now we have medical affairs where we understand the data that is coming in the form of insights
Okay.
and the understanding of the market. We also analyze that data and shape our communication, which is now transforming. It's already there and even more evolving in terms of the omni-channel communication that we have. Because the center of this is how we communicate the science internally and externally to the right stakeholder in the right way that they understand.
Mm.
So it's always about you create that curiosity and the pull for people to understand the disease and the therapy at a larger scale. I'll give you one example. One of the early therapies that I was working in, it was a novel therapy, and the challenge with that was there were subtypes of that particular disease. I'm not disclosing it because of the
Yeah.
conflict of interest. So there, the challenge was because there was an overlap in the treatment, both these subtypes were not being precisely diagnosed. And
Right.
now, with the launch of this molecule, there is more emphasis on actually diagnosing both
Mm.
of them individually. So that's where I was mentioning that the launch is
Yeah.
beyond just a molecule. And when I think about my journey as a clinician, so I feel that as a clinician, we have a lot of strengths. For example, we have a deep understanding of the science and we have that clinical intuition of where would this fit in and what would be required for our patients to understand that disease better. And obviously, we work in a lot of ambiguity and uncertainty, and that is the time we take very strong decision as clinicians, right? And that helps us when we move from being a clinician to medical affairs. And last but not the least is the patient centricity, as I was talking about. But having said this, there are a lot of things that we need to unlearn. We need to unlearn these things before we move to a medical affairs. Like one of the very important thing is that when we are treating patients, we are the sole decision maker. At the end, we are basically the final authority
Mm.
of making the decision in medical affairs, in corporate. It's always a collaborative approach.
Mm.
And that needs to be taken care of, because this is one of the factors which I have realized with some of my colleagues move to medical affairs. They could not find this as the right fit for them
Right.
because of this particular trait. And then they move back.
Yeah.
And second thing is that if you see as a clinician, you see immediate results.
Yeah.
You treat a patient, you see outcomes within a short span of time.
Mm.
However, in this role, you have to literally wait, be patient, and look for a long-term vision, and then see the impact of your initiatives or
Yeah.
strategy that you're developing, right? And that reflects that as a clinician, we are more focused towards perfection,
Yes.
right? We need to be precise in the treatment that we are giving to the patient. But when we shift, we need to focus more of progress over perfection,
And I think,
because the future of medicine is precision and customization, personalized.
Mm.
So that is very, very important.
Yeah, I just want to take a small detour here as well to kind of talk about just generally clinician careers and I guess when it comes to doing non-clinical careers and stepping off the usual path, I think there's a very similar perspective of not knowing where it's going to lead to. I think as a clinician, you when you are within this world, you kind of know, you do these exams, you get that job, you apply, and you kind of have like very set metrics that tell you exactly where you are and where you're going, very external feedback driven. And I think when you step out and you're trying to do something new, something different, that progress over perfection is really hard. And I think, a good strategy takes time to show its benefits and its efforts to know that you've positioned yourself correctly, and kind of just hold the line and just stay where you are is a really tough thing for many people who are stepping out. So what might be like one perspective shift or some advice that you might give them to say with the strategy for a bit longer so that they can actually see the results they're hoping for?
So one thing that right now we're moving towards is, we're moving towards a role which is where we decide the impact beforehand, right? So we have a journey, we map the journey. And if you ask me, one thing that has helped me succeed in this role, and I'm still evolving, is because I map the journey for all the initiative that I take from the patient's perspective, from my HCP perspective, and the internal
Mm,
perspective. Keeping all these stakeholders in mind, I map the journey and I see where is the impact that I can measure.
right.
And that is where I can demonstrate the impact,
Okay. So
right?
start with the end in mind, but then also map your landmarks along the way already. So you know when you've reached there as you're making progress. Okay. Yeah.
And at the center of this is the clarity.
Mm,
And our role as clinicians, even though we may be good at deep understanding of the science in a complex way,
yeah.
but our stakeholders may not understand the same. So
Mm,
it is our duty to simplify and make this communication in a way that a layman or
mm,
even your internal stakeholders can understand and utilize it for a bigger impact,
yeah. Yeah. I
right?
think I love how it all comes back to some really common principles about leading change and adoption and innovation. And I mean, I'm drawing immediate parallels to the kind of work I do through my coaching. And it really is about like, okay, what is the clarity? How do you set stone in terms of where you want to get to? And then we use assessments to give us information, and we create landmarks and checkpoints. And it's a very, very similar journey of executing that strategy and leading change. Very, very exciting. So, yeah, thank you so much for sharing that side of it. I want to quickly go back to the ladder of medical affairs. And you said you started off as an MSL and then you gradually changed. The responsibilities become a bit more strategic and less sort of on the ground. Just give us a bit of an example of what does an MSL do, and then when you become more senior, what does that role look like?
Okay. So MSL is basically the field medical team
Hmm.
where they are basically the eyes and ears of the core medical team at the head office. They are the force where they go and interact with the HCPs and not just disseminate science, they also help us understand what is the ground reality, and they are the ones who share the insights with us.
Hmm.
And for us in the head office, we take these insights and see what are the actionable points, what are the actionable insights which can, reshape our strategy. And it also gives us a very good perspective on, is there any gap in what we're already planning to do and the ground reality.
Okay. So,
So
MSL is like the junior doctor collecting history, coming to the consultant and having a conversation, and then the consultant is a bit more of the decision maker with experience and strategy around it.
kind of, but right now it's also evolving because these MSLs are now being part of the decision making.
Hmm.
Why? Because they understand the HCP better. They know the profile, the behavior of the HCPs much more in detail than what we would know
Right.
sitting at the MFM. And this is combined with the data gaps that come in from the field
Hmm.
medical. These data gaps help us plan our future either the real world evidence or HEOR or any other study that we want to conduct. So that's where there is a bridge. And when we move to the HO role, it's like a combination of what I mentioned earlier. You collaborate with different functions to plan your medical strategy. And now we are moving into the customization phase.
Okay.
We customize because we have different personas of HCPs. Like we have different personalities. So everything we're trying to understand different personas and how would they want to communicate with us?
Mm.
What is their channel of interest, preferences? So that's where we customize our
Wow.
communication. And that's where we require, the simplification of the science from a complex data. Now you can imagine I was working on one of the real world evidences with patients more than 6,000,
Okay.
right? So you can imagine the amount of data.
Mm.
The goal was to simplify and customize these data inputs into a different categories. So we divided this into someone who would like to know only the key messages,
Okay.
someone who would like to know the depth of the analysis of everything related to the graphs and data points,
Mm.
someone who would want to grasp this knowledge in a video format, like a more of an interactive format. So we are moving from, so now you can see the core medical affairs moving from just the data driven understanding to a futuristic view where you
Yeah.
can actually do it using the omnichannel approach.
Yeah, what's most exciting for me is that you're literally doing this for a new molecule. Like just one thing requires so much work around it for it to be successful. And I think a lot of my listeners are often interested in AI, health tech, and sort of new things and new adoption of new tech and new ideas and leading change. And it just goes to show like how much work is actually needed for a successful adoption and successful launch of something that's new in the world. And I think, again, I've had a very similar experience with recently launching my group program, the Clinician Impact Actionship. And literally, it is about having those conversations one on one with everybody and getting to know them, getting to know who you're talking about to, getting to know what's their pain points, what are they looking for, what do they want, what's the best method of communication. And it's also the reason why I have so many different channels. So I post on LinkedIn in text, I create this podcast for audio listeners, and then the video on YouTube. And I think some very common principles of leading change again are coming through in this conversation. So that's very exciting. And I'll be honest, I never saw medical affairs as the way to get there. And I don't think I actually even, I was a bit ignorant probably. I didn't spend time to think about what is medical affairs. And I thought it's just kind of people who sell drugs to clinicians was kind of my understanding in very layman terms. But clearly in our conversations, I've learned a lot more about what it is and what it takes to get there.
Yeah, because it's actually moving. What I feel is there needs to be a mindset shift, right? From reach to relevance. It's a very strong word,
Mm,
right? We were just focusing on how many doctors we interact with, how many activities or CMEs that we conduct with leading physicians, to actually looking at what is the relevance, what is the impact. And
yeah.
that's where, we as medical affairs are moving from getting invited to the table versus actually earning our voice in
Mm,
it. Because we have been able to actually establish the impact of what we are doing, right?
yeah.
And now, more and more, we are also evolving in how we can measure this impact and contribute.
Mm,
That is the center of how it is evolving.
really.
And as one of my mentor also said, the goal is to move medical from a function to the force of the pharma organization. Because as I was mentioning to you earlier, ultimately for any healthcare organization, it is the patient and the science at the center of it.
Mm,
And as clinicians, we understand it a bit better than any other function in the organization.
yeah. And I think very similar trends within the hospital as well, where clinicians are moving more and more into administrative roles, into chief exec roles, into chief ops roles, chief clinical information officer roles, the tech side of things as well, because we bring that intersection of knowing what the system is like, what the patients need, what's actually possible, and what's available, plus the science to back it up. So I think that's really, really valuable. I think with that, let's go ahead and do a bit of a swap and see if you've got anything that you'd like to ask me.
Cool. So as I was mentioning that I already love the journey that you've taken with Medic Side Hustle. And, you know, I I really feel that I'm sure that you've interacted with a lot of clinicians now. And since you've spoken to them and understood how they have transitioned from traditional clinical practice into the diverse roles, either it is pharma, medical technology, health tech, or preventive healthcare,
Hmm.
right? There are even more roles like consulting background, multiple roles. So, what is that one theme or the mindset that you see in those who thrive after making this switch from clinician to a different diverse role in medical?
Yeah, I think very interesting. So, one of the words that I would say constantly comes up in, especially in these podcasts and these discussions, is audacity in the nicest way possible. I mean, I feel like most successful clinician journeys, there's a point of being absolutely very audacious and just like going for something that they have a true belief in, even if it's likely to be unsuccessful. They position themselves in a place where they're relatively stable and can jump off that boat into something new. And it's a leap of faith, and it's a bit of audacity to say I will be successful. But they have that belief in themselves even before they've achieved anything else. So I think a lot of people tend to wait for, having proof of success to create more success. But it's actually the ones who believe in themselves to create the success before even having anything that tend to do it very successfully. It's a very paradoxical thing, and it's something that's very hard to hold on to. It's not tangible. It's a mindset, it's a belief. But I think that's probably one of the biggest things. And of course, along with that is strategy. Of course, along with that is mentorship and having a bit of a framework to support you on that journey, which is what I try and do for the people I work with. But really, it's about that mindset and the belief to really get there. And if you're willing to do that, there's all of the support out there in the world, free and paid, and all sorts that'll actually get you to your point of success. It really begins, I think, with that audacity.
I completely agree with that. And I also feel that, you know, having a good conversation, either with your, mentor or a colleague or someone who is actually giving you an advice is basically not solving your problem. It's
Mm,
just helping you understand yourself better and see, are you ready to take that risk?
yeah.
Are you ready to take that step or a move towards the direction that you always wanted to take? Because, there is a lot of scope to understand yourself and see, you might like to think beyond just one-on-one patient care,
Mm,
because medicine teaches you how to care, but then you can actually build your whole canvas
yeah,
and then see how you can scale it,
exactly.
right? So that's the whole, journey towards understanding yourself. What is that drives you and what do you want to do in future?
That's exactly it. I mean, you've stolen the words right out of my mouth. That medicine is only part of the way in which you make an impact in the world, and there's so much more out there. It's about self-discovery. It's about showing it to the outside. It's about responding to the data that you collect as a result. And that's the journey I've loved taking for myself, and I love taking with the people that I work with. And yeah, it's just that bit about leading change for yourself, leading change around the world, and making an impact. So yeah, that's beautiful.
Because once you understand yourself better, the more you deep dive into your belonging, you have more clarity.
Yes.
And it goes for everything, whether it is part of your strategy. And I firmly believe the strategy word is basically related to clarity. The better
Hmm.
clarity that you have in whatever you are thinking or planning to do, the better the outcome would be.
Yeah.
And this journey or the side hustle that you're planning to take, more and more clarity that you have, you would do better. But again, one most important thing that I feel is do not wait to get 100% clarity. That is a journey. You
Yes.
start, you take that first step, and then you become more and more clear about your calling as you grow into your role.
Yeah. Yeah, I think there's a saying that confidence comes from competence, but confidence also comes from clarity. And I think it both go really much hand in hand, that you have belief that the direction you've set and you've taken is the right one. And then once you take that journey, you get more and more clarity as you go along the way. So that's absolutely lovely. I'm hoping that you found this conversation insightful and interesting, and perhaps a bit inspiring in terms of where you can turn to lead change and learn about leading change and making an impact in the world and gaining those skills just the way Dr. Keshwani has. And yeah, thank you very much for tuning in to the Medic Side Hustles podcast. Our next podcast will be with the amazing Dr. Kari Shah. We'll dig into her career from trauma and orthopedics to management consulting and eventually to big pharma as well. You won't want to miss that one. By the way, if you're unsure about how ready you might be to go beyond medicine, try my quiz that I'll leave in the comments and the description below, or go to my website, www.coachwithshub.com/quiz. Right. Any final actions or takeaways for our guests, Dr. Keshwani?
Just take that step forward. And you will have, as Shub mentioned, you will have all the resources at your disposal.
Yeah,
Just that
fuck it,
one
just do
step.
it.
Yeah, just take that one step.
That's amazing. All right. So I hope the conversation sparked some ideas and inspired you to think bigger about your career and your impact. Until next time, stay curious, keep solving big problems, and remember, you have the power to create something extraordinary. See you soon.